Okay, I think I'm ready to get started here. Hello, everybody, and welcome to our presentation on depression, finding a way out of darkness. My name is Daryl. I am a therapist and a counselor. I work with IBH, one of the sister companies of RBH, and I'm going to be presenting today on depression. And we do have a lot of slides to cover. If you do have questions or anything, there is a question section on the panel where you can submit questions, and Brenda, who's with me, will be watching out for those. So definitely feel free if you have any questions that you want to ask. But today we are going to talk about depression. It's a very common, desired topic right now for a lot of obvious reasons. And just to give you a brief overview, we're going to talk a little bit about prevalence. I'm not going to stay on that very long. We're going to talk about a little bit about symptoms and different types of depression. We're going to talk about diagnosing and treatment, relapse prevention. We're going to have a little bit of a self-assessment we're going to do, and we're going to talk a little bit about getting support. I do want to say that we're not going to focus on, this isn't teaching you how to be a counselor or to do diagnoses, but we're just going to sort of cover this so that you have a better understanding of depression and how it can affect somebody. We're going to take a little bit of a look at prevalence and how common it is. And again, we're not going to give lots of details, but just to give you an idea of some of the things that you might want to know in terms of prevalence. And it's more common than most people think. Someone you know could be suffering from depression and you don't know about it. Actually, there's a very good chance that somebody that you know is suffering from depression that you're not aware of. You may be suffering from it and don't want to tell anyone. That's common for a lot of people. There's a lot of stigma about mental health issues and depression. And it's something that needs to be talked about more and more. And you can see that with a lot of the problems that we have in our society, with suicide and a lot of other issues. So I mean, there's a lot of people that are suffering from it. And just a couple statistics: 17 million American adults suffer from depression in any given year. That's 7% of all U.S. adults. So that's seven out of 100 people suffer from depression. And we're not just talking about being sad. We're talking about actually suffering from depression, a diagnosable disorder. And we're going to talk a little bit about the difference between sadness and depression today too. Everybody experiences sadness, and we'll talk about that in a little more detail. This just gives a little bit of an overview of who's depressed in terms of gender, age, and race, ethnicity. The highest that you see in here in terms of obviously female, I shouldn't say obviously, female tend to suffer more often than males. Young 18 to 25 young adults, very common. And then the various ethnic groups having identifying as having two or more race or ethnicity groups have actually the highest rate of all ethnicities or races in terms of depression. Those are generalizations. Everybody can suffer from it, but it gives you an idea of where it tends to disperse itself. Depression and suicide are linked. They're very heavily linked. At least half of people who commit suicide have depression, and and that's diagnosable depression. From 2% to 9% of people diagnosed with depression will go on to complete suicide. And people with depression are at 25 times greater risk for suicide than the general population. So being aware and seeing symptoms and being aware that depression is around you and being able to identify it becomes an important thing, because it really is important in terms of first identifying that it's there, and then you can start looking at making sure people are safe and other issues. So we're going to talk a little bit, like I said, about depression versus sadness. You want to know when it's bigger, when is it depression and when is it sadness? And so am I sad or am I depressed? And this is a little bit of a self-assessment. It's an interactive exercise. If you want, you could sort of just look at it for yourself and answer these questions for yourself. Do I still enjoy doing things I've always liked doing? So I could be very depressed, but I might really enjoy still doing other things. That's significant. Are my emotions related to a specific event? Um, Grief, even though it's gotten a diagnosis just recently, it did not used to be a diagnosis, but they've given it one primarily so that insurances will cover it. But grief, when somebody passes away, that's like a specific event. Feeling sad and all of those feelings around a specific event, like somebody passing away, is not depression. I mean, it's normal to feel sad when somebody passes away. So that's a good example. Am I eating and sleeping normally? And these are all things you want to look for. Do you still enjoy doing anything? Is it focused on a specific event? Changes are major. Now they talk about eating and sleeping normally. Now somebody in their normal state might sleep very minimal hours, or somebody might eat a lot. Some of us eat a lot. I'll use myself. But if that's normally how I am, one of the significance things that you want to look for is if there's a change in eating or sleeping. That's really the key thing. Um, do I have variations or breaks in my low mood? So if I'm feeling down sometimes, but then I'm feeling up sometimes, that's important also. Do I experience self-punishing or extremely self-critical thoughts? How do we look at ourselves? Are we always looking at ourselves as being less, as being inferior? Those kind of things. Very important. And obviously, am I having self-harming thoughts? Do I want to hurt myself? Those are significant things to ask. Very significant things to ask. Now, just to give some examples of symptoms of depression, these are things that you'll see. Feelings of guilt, worthlessness, and helplessness. Helplessness, another big one is hopelessness. So sort of feeling guilty or sad, sorry. I'm tired and fatigue is a common symptom of depression. Feeling hopeless and feeling like giving up, not really believing that anything's ever going to work out. Wanting to be left alone, isolating, any form of isolation, doing things by yourself, leaving uh, groups, quitting groups, stopping hobbies, different things like that, and difficulty concentrating and remembering details. These are all good examples of symptoms of depression. Now, again, we're not trying to teach you how to diagnose somebody. Everybody will experience these feelings sometimes, all of them. We all experience them sometimes. So you're sort of like putting it together and looking at it as a group. The more that you feel of these things, then the more likely you're experiencing some depression, and that becomes important. This is another one, and this is big, irritability. I'm feeling angry, impatient, losing temper. Now, a lot of people wouldn't recognize this as depression, but this is a very common symptom of depression. I'm having physical symptoms, having aches and pains, headaches, stomach problems. I think we've all probably learned that stress itself is an example. Stress is something that interacts with our body. Depression interacts with our body. All of our mental health issues all interact with us in a physical. We're beings. You can't separate us from our physical and emotional selves. So it tends, to affect us from a physical point of view. Again, giving up, morbid thoughts, suicidal thoughts, feeling nothing, um, empty feelings, uh, worrying, overthinking. So there's different ways. I think it's important to note that I'm showing symptoms, but some of these symptoms don't match other symptoms. So people do experience depression in different ways. One person might feel more irritable, another person might feel more sad. Not being satisfied is another good example, which might show forth as overeating, loss of appetite, changes of weight, drinking more. Those are all symptoms of depression. Now, sadness is a normal reaction to life events. Everybody feels sad. We all feel angry. We all have happiness. We all have sadness. We all feel stress. That's normal. Whoops, hit the button. It's not abnormal to experience sadness. It's normal in certain times, in certain ways, but it's common for reaction to events, changes, disappointment. It's part of being human. It usually doesn't last a long time, and so it doesn't. And this we're going to come to. Well, anyways, I was going to get ahead of myself. So it's normal. It usually doesn't last a long time. You will feel low, down, and blue. Everybody feels that. Not sadness is not depression. Someone may say they're depressed, but if it goes away on its own and doesn't impact their life greatly, it's probably sadness. We use those words interchangeably, but when we talk about depression in our field, we're talking about a more serious issue. Sadness is normal. However, sadness is one symptom of depression. It's one common symptom of depression. Most people who are depressed feel sad. That's a common thing. Notice I said most. Some people don't identify, they probably are feeling sad, but some people don't identify sadness in their depression. Some are lean more towards the anger and the irritability and those kind of things. So, it's possible to feel sadness and not be depressed, but it also could be a symptom of depression. Depression is a real illness. It affects your mood, the way you understand and think about yourself, the way you relate to things and to people around you. It really can affect every aspect of your life. It's not caused by an event. It can be caused by an event, but but it can occur for no reason whatsoever. Now we said that if you had an event could lead to sadness, but event also can trigger depression. It's much more intense than sadness. It typically is longer lasting. It's more difficult to get rid of, and it typically is more encompassing of your life than just certain parts of your life. It typically lasts longer than 2 weeks, and it usually won't go away on its own. It is treatable. And it has different names. There's a lot of different names for depression, and there's different types of depression, which we're going to touch upon, although we're not going to get into them in too much detail. Again, this isn't a counseling or therapy class, but it does have some different names. So anybody, and don't forget, if you have any questions or comments or anything, feel free to put them in the questions section. Common types of depression. Here's some of the types. Again, I'm not going to get into all different types. There's a lot of different types of depression. The major depressive disorder is one of the more commonly known ones. That's major depression. There's depression that is related to other things that are going on in life. These are examples of that. Treatment, premenstrual is a common one. Another one that's I don't see up here. Well, you have seasonal affective disorder, postpartum depression, bipolar is a form of depression. There's more. This is just some samples of it. And we don't want to. I'm not going to get into like how to tell one from the other because that's not what we need to do. But we do want to look at when and how to get help. That is important. When and how to get help. So when do you get help? Different types of depression share some symptoms. There's some common things among all depression. There's definitely some common things among all forms of depression, which we're going to look at some of that. Other health conditions can have similar symptoms. So there's other things that could look like depression, but they're not necessarily depression. Different treatment is prescribed for different types, looking at what types of depressions that you have, and a medical professional is something that's needed to make a diagnosis um, based on symptoms, life functioning. See, when they diagnose depression, they're going to diagnose it based on a lot of different things, not just not just the list that we talked about or some of the things we talked about. They really look at it, and they look at it in the context of what else is going on in a person's life and a lot of other things. So there's different things, uh, different ways of looking at it. Um, let's see. Trying to click here. Let me get in there. Okay, so getting a diagnosis. To get a definitive diagnosis, your doctor will make sure you understand the assessment questions, because they're going to ask you some questions and they're going to want to make sure that you understand them. They're going to consider other relevant information and health information, because those things could have an effect on depression. They're going to confirm if the symptoms are impairing social, work, or other important areas of your life. It's one of the things in all diagnoses in mental health. Technically, there's a book of diagnostic manual that lists all of the diagnoses that psychiatrists and psychologists and therapists use. One of the defining factors in almost every diagnosis is that it has a significant effect on your ability to function. Again, we all feel sad, we all feel angry, we all feel anxious. This is a big thing, is how it's affecting your life, whether it's socially, occupationally, or other areas. And they always do want to rule out biological causes, because there can be biological causes to that'll lead people to feel depressed and down and melancholy and all of that. What to expect from treatment. So, as with any illness, your treatment plan should be tailored to your specific diagnosis. So, depending on what somebody's diagnosis is, your plan could include one or more of the following treatment options. Medication is an option. There's a lot of people in my field and in the world that have very strong views on the use of medication, both for and against and in between. Um, and you could have a whole argument and discussion about the use of medications with depression and such. But there are medications that are effective, that have been shown to be effective in treating people and helping people with depression. There are different types of medications that are geared towards different types of depressions. For example, there's medications that are geared towards major depressive disorder versus bipolar disorder. So knowing the right medications and if it works for you, and you always want to work closely with a doctor for that. The right form of psychotherapy. People think of therapy and counseling, and most people think of it in just as one sort of lump sum of things. There are numerous methods of therapy. And again, that's one of my profession. That's my profession, is I'm a therapist. And there's cognitive behavioral therapy. There's Gestalt therapy. There's a whole slew of different styles of therapy. And there's been studies that have been done to show that different types of therapy work better with different types of depression or issues, depending on the origin of the depression and the type of depression you have. And then obviously another thing is the self-care. Because a lot of how you deal with depression is going to be you having a commitment to taking care of yourself. It's one of the battles of depression. When people are depressed, they lack motivation, and they don't want to. We have a tendency when we're depressed not to want to do the things that will help us to come out of the depression. So there usually is a part of the plan is some homework or activities or things that you're stressing that you're going to focus on for yourself to get out of that, besides medication and therapy. And a lot of that is going against the grain of what you want to do because of your lack of motivation, but that's an important part of the treatment plan. And social support is another huge thing in dealing with any mental health issue. Social supports are critical, and they can be used for a lot of valuable things. Checking where you're at, noticing if you're not doing things you should be doing. Obviously, probably the most important thing is being supportive and encouraging and giving us support. This is critical to all treatment. Again, social support. So those things are very important. It's another thing I want to say, and I've worked with people who feel very helpless and hopeless frequently, and there's definitely a tendency for people to think that there's nothing could be done. I had a gentleman on the phone recently who said, nothing can help me. There's no help. There's no help. Nothing can ever change. Um, and a lot, and but that's not true. I mean, evidence shows that treatment is effective 60 to 80% of the time, which is quite a bit. And it's that's important. That's super important to realize that you can get help from depression. And I've met people and I've seen people, and I've experienced it with family and in the profession, where people have gotten treatment and have gotten better drastically. So that's important. One of the one of the main symptoms of depression is hopelessness. So, overcoming that hopelessness by giving witnesses is important. It's important to keep working with your doctor um, for a number of reasons, um, because, give some examples here. Treatment resistance depression exists. Treatment resistant depression is a depression that sort of is it's caused by treatment in the sense that people are resistant to treatment. There's a thing where one of the things I've noticed in my profession, people like to believe. A lot of times we like to believe that our life is the worst life anybody can experience, and nobody else can understand that. And so when people tell us that there's hope, and when people try to change it, there's oftentimes a natural resistance to that where it has the opposite effect. So you have to be aware of that and watch for that happening. Um, People try several medications to find one that works. Um, every medication works with different people differently. Something might work with you that didn't work with somebody else, and it's important to work with your doctor to keep in mind of how the medication is helping you, or if it's helping you and not helping you. People don't stick with the treatment plan. That's a very common thing. It's very common for people not to stick with the treatment plan. And relapses are common. And this is important. There's I say new, but there's a fairly new treatment that's used in addictions in all areas, talking about the change cycle. And the truth is that when we're trying to change behavior, the relapse is a common part of the change cycle. It's part of it. It should be expected. So that's important. And a lot of people don't seek treatment at all. That's very common. So it's important to stick with the treatment plan. Among adults with a major depressive episode in 2016, 63% received treatment. So that means that 6 million people, nearly 6 million people in the US did not seek treatment for major depression that had it. So it's something that frequently goes untreated and ignored. Some statistics regarding this is 2016, treatment received among adults with major depressive episode. 6% did medication only, 37% didn't get any treatment at all. 44% did health profession and medication, and then 13% did just the health professional. Health professional being like a therapist versus getting medication. So a lot of times it doesn't go treated. So when depression is untreated, it obviously is going to cause more issues and problems, because when you have depression, like I stated earlier, it affects your life. It affects work. It affects social life. It affects every aspect of your life. So when untreated depression usually doesn't go away on its own, we already mentioned that, and it could run into a lot of problems in terms of what it could ruin. It could really hurt us in terms of our relationships, parenting, um, family issues. There's an increase in risky behaviors that's very common with people that are, the longer that people are depressed and the more severe the depression gets. Substance abuse is highly linked to depression and suicide. Alcohol and drugs, very close link in those two things. There's a tendency for people that are depressed to think that a drink makes them feel better. And I say a tendency that they think that. I think that people, when they're depressed, when they're drinking, they may feel better, but the alcohol overall tends to increase the depression overall. And there's a lot of studies that have supported that. Um, and the longer that you have a problem and let it go without being treatment, just like physical problems, the harder it is to overcome it. It's just like physically. And again, could cause problems at work, and actually could cause damage to your brain. Um, for a lot of reasons that we're not going to get into right now because we don't have time. But you end up brain fog, they mention here, um, because your brain just stops working as well. The depression takes over, and you're not thinking clearly. We talked about some of the symptoms earlier of lack of concentration, the inability to focus. All of those things sort of set in. So. Um, let's see. Depression varies by individual, and I mentioned not only does it vary by severity, but it also um, varies drastically in terms of how it manifests for people in their life. But there is mild depression and there's severe depression and all kinds of levels in between. Some people have depression for a short time, some have it chronic, and some people have to deal with it most of their lives. That's not true of everybody. Some people suffer from true depression and it's treated and it's gone. It could happen once in a lifetime, or it could keep coming back. Um, and it also can be tied, like sadness, to special life events such as seasons or childbirth and things like that, which is where we get like postpartum depression and seasonal affective disorder and things like that, where it's chained to those kind of events. There are ways to help to prevent uh, relapse, because relapse is common. So if somebody's experiencing depression and they're getting they're getting it under control, then there's ways to prevent the relapse. There's ways to prevent the depression of relapsing back into the depression. There's things that you could do to prevent it. It can come back even with the best treatment. 60% of those who've had a depressive disorder will have a second. 70% have a third, and of those who had 2 episodes have a third, and 90% of those who have had 3 episodes will have a fourth. So the more frequently that you have them, the more likely you're going to have them again. So it is common for it to come back, but it doesn't have to. And there's things to do to prevent that relapse from happening. And these some very good tips: preventing or limiting a relapse. Know your triggers. There's things in your past that will trigger your depression. So you want to track these. It's very important to know what triggers your depression. It could be that you have a bad relationship with a family member, and when you have an interaction with that person, it triggers your depression. It could be when you have a problem at work and you maybe you don't perform up to your expectation, and that could trigger it. So there's different things that trigger it. It's important to know what triggers it, record them, keep track of them. It's important to know the signs of your depression. Everybody's different. Again, the signs of your depression. So like I said, some people start getting irritable. Some people start to eat more. And you will know if you track them, you would be able to tell early on. There tend to be early signs of you going into a depressive state, and then there'll be signs later on too. So you want to try to find the early signs whenever you can. The first sign of relapse, so as often as change in sleep pattern, that's a good sign. That's very common. So you want to watch for those signs. Other ways to avoid relapse, again, it's using the things that we talked about as part of your treatment. Um, your your um, your support system, stay social. This is huge. It's a very important part of it. Again, when you start feeling depressed, there's a tendency to withdrawal, so you got to push yourself to do that. Talk to friends, go to the therapy or counselor, exercise, and staying busy. These are all some examples. You could probably all think of hundreds of examples of things that would help you with depression. Pets have been known to do it. Music for some people. So know what helps you too. And very important, get help. If you sense that it's returning, get help immediately. You want to try to get help as soon as possible. That's critical. So we're going to look at a prevention plan here. This is an interactive exercise. Any responses or scores are just examples and are not meant to be used or to diagnose training participants. We're not trying to train you, but we are going to, let's take a look at events or situations that triggered relapses in the past. So we mentioned that. So what events or situations have triggered relapse for you in the past? Or if you're not depressed and you know somebody that's depressed, what events do you think may have triggered you in the past? Or them in the past, rather. These are some examples: grief, social anxiety, parenting difficulties. And if I had the ability, I'd get your feedback for your own. But think about some of your own things that would trigger depression. So the triggers, again, the warning signs. So what warning signs have you experienced in the past? And just think for yourself, what are some warning signs that you may have experienced? Again, they mentioned sleep patterns. It could be a lot of things. Everybody experiences it individually. The common ones that they talk about: sleep patterns, changes in eating patterns, irritability, again, is a big one a lot of times. Isolating, canceling plans, difficulty concentrating. These are all warning signs. And then things that help me when I feel an early warning sign. So if I see that I've had the triggers, I'm starting to see some warning signs, it's more important to focus on the things that help you. And again, list is just a list of common things and important things. But we all have our own, and it's really important that you become aware of what makes you feel good. For me, I'll use me as an example. I play the piano, and I play the piano for recreation, and I've done it since I was very young. I thought about going into it as a profession, but I actually enjoy it for the purpose that I like it for, which is it relaxes me. I didn't want it to be a job, so it's something that when I'm feeling down or I feel, if I'm struggling with stress or whatever, that helps me. So you want to look at what helps you as an individual. What works for you? People who help me and what I would like them to do. This is good. It's good for you to think about people that are positive for you. A lot of people say, well, talk to your parents. Well, if you have a good relationship with your parents, talk to your parents. The important thing is to be aware of who in your life is good for you, who in your life makes you feel positive. Those are people that are healthy to be around, and you want to try to use those people in the sense of being around them and accepting their support. Another thing is we tend not to want to take people's support, but it's something we need to do. It's part of what we all need to do. And who will I share this plan with so they can help me? And they're just giving examples here. So there's sort of a relapse prevention plan. Okay, now they're going to talk a little bit about a crisis plan. Now, a crisis plan is a plan that you're going to want to create if the depression gets so bad that you're really getting into a crisis. And obviously, the most common example that people would think of with that would be that somebody might be getting suicidal or thinking about hurting themselves. So, what would you do in that case? What can you do if you were in a crisis? This is important for somebody that's experiencing severe depression to have as a crisis plan. So you have a relapse prevention plan. You want to have a crisis plan also. Um, sleep is helpful, especially if you're not getting enough of it. Again, calling a friend, journal. Writing is helpful. Um, so, how do I regain balance and calm myself or make myself safer? There's three parts of this plan. This is one of three. How can I regain balance? Music, again, these are things that are helpful for you. And again, people that I can call in a crisis. This is important. You should be aware of who you can call in a crisis. A friend is a good person to call if you have a friend that you really trust. And some people would feel more comfortable calling a friend than calling a crisis hotline. Some people would be more comfortable calling a crisis hotline than a friend. So having access to multiple sources if you're in a crisis is important, of people that you might call in a crisis. So it's important to have a plan of who you would call. This isn't just thinking about this casually. If somebody's dealing with depression, they should have a crisis plan. Resources I could use to stabilize myself. Family time, EAP, and the EAP is who we are. The EAP is available for crises. It's important. And I will say this, if you ever have a question about whether somebody might be depressed, or you looking for guidance, or you think you might be depressed, or you are depressed and you're worried about hurting yourself, you could always call your EAP. That's what we're there for. And there are online support groups and crisis lines that are available too. And part 2 of 3 of the crisis plan. I think I need to move a little quicker here. What can I do to help or keep me safe? Talk to me. What I or others can do to help or keep me safe? Talk to me. Hike. Go for a ride. So other people, are part of the plan. Being aware of medications that have helped in the past. Not just medications that have helped in the past, but treatment styles, a particular counselor, but definitely the medications. It's important to be aware of what worked and what didn't work. And there's the medications that didn't help. And alcohol never really helps, even though sometimes we convince ourselves that it is. And being aware, obviously, to know what medications you are currently taking. And then part 3, if I'm feeling overwhelmed and the following people have agreed to help me. So this part 3 is actually, you have some direct numbers. This is an important part of the crisis plan or a treatment plan, because you want to be able to know specific people to call. This is critical in a crisis plan. Specific people that you could list that you will call if you're in a crisis. And not only specific people to call, but also what people can specifically do for you. So here's my partner. What could the partner do? Help more around the house. Friend 1, say, I'll pick up the kids. I mean, looking for assistance. This is one of the hardest things for us to do in our society, is to ask people for help. And that's one of the reasons why things like depression and other things go untreated, because we do have a hard time asking for help. And it's critical that we do that. It has to be done. I mean, more people, I think, don't get through depression and things like that because they just don't feel comfortable asking for help. So, all right, we're going to take a little bit of a look at a self-assessment here. If you might be depressed or feel like uh, you could relapse, consider a self-assessment. So let's look at some questions. And again, these are things that some of us could ask ourselves. On the following slides, we're going to look at questions adapted from the most common depression assessment tool used today. Some of you may have completed this assessment at a doctor's appointment. Okay. Some of you may have, because a lot of doctors use this, they use it a lot in a lot of different settings. Sometimes it's part of a lot of routine exams, actually. We're going to go through the questions with you so you can see what it might be like to experience the assessment. All right, let's get this kicked here. A depression assessment, usually the first step in a diagnosis. Typically, they'll ask certain questions, and that's the first step of diagnosis. You can take a self-assessment online or complete it with a healthcare professional. There are self-assessments online. I know there is on the IBH website even for depression and anxiety. If you do a self-assessment, it is recommended that you print it and bring the results to your doctors if you're concerned. And there is a link here to download this assessment if you're interested on this link. And I'll mention this too. This is being recorded and will be accessible, made accessible to you guys at a link later. I think Brenda will help with that, but this training will be available to you, where you can get some of this information. All right, so let's look at some assessment questions. Okay, and the choices are, and I want you to answer for yourselves as we go through this. Excuse me. So your choice is 0 through 3. 0 being not at all, 1 several days, 2 over half the days, and 3 nearly every day. All right. Little interest or pleasure in doing things. Think about where you would fall on this. Actually, if you can, go ahead and write your answer down, and we'll get a score at the end. Little interest in or pleasure in doing things. 0, not at all the way up to 3, which you feel nearly every day. Feeling down, depressed, or hopeless. Same thing, give yourself a score. We've given scores in here as an example, but think for yourself and give yourself a score. Trouble falling, staying asleep, or too much sleep. Where are you at this from 0 to 3? 4, feeling tired or having little energy. 0, 1, 2, or 3. Poor appetite or overeating. Again, changes in eating or sleeping are always a big one. Feeling bad, 6, feeling bad for yourself, or that you are a failure or have let yourself or your family down. Again, not at all. Several days, over half the days. Think about this and score it for yourself. We'll take a look at the score meanings, like where it puts you at the end. Number 7, trouble concentrating on such things as reading the newspaper or watching TV. 8, moving or talking so slowly other people may notice, or being a lot more fidgety and restless than usual. So either one. Again, moving or talking really slowly, or just real fidgety and moving, restless. Notice again, they're sort of opposite things, but they're both symptoms of depression, or can be symptoms of depression. 9, thoughts of hurting yourself or that you'd be better off dead. That's 9 questions right there, right? All right. Now in this example so far, there's 9 questions. There's a total sample. The sample score we gave here is 19. Okay. Now if you scored just 1 point of the maximum 27 points, so if you did you get that? If you all scored yourselves, there's a maximum of 27 points possible, and 19 was the one in this one, but 27 is the maximum. But it asks one more question. If you scored even just 1 point out of the possible 20 questions, then you're asked the 10th question. How difficult have these problems made it for you to do your work, take care of things at home, or get along with other people? This is a big question, and I stated it in the beginning. It's a major question because question 10 is asking you how it's affecting you. Whether you picked 1 or 2 or 10 of those things, is it making it hard for you to work? Is it ruining your relationships? This is a very important question. That's why it's separated like that. So you would answer one of these 3. Now, just looking at the overall score of the 27 questions, this is how it's broken down. Depression severity. Now, this isn't diagnosing. You can't use this to diagnose yourself. It's just giving you an idea of someone's depression. So 1 to 4 is minimal, 5 to 9 is mild, 10 through 14 was moderate, 15 through 19 is moderately severe, and 20 through 27 is severe depression. That's an example. Again, you don't go home, give us your friends, just diagnose each other and everything. It's much more complex than just asking these few questions, but it gives an idea of where somebody's at. And again, if anybody has any questions, make sure you put them in. One major important thing that we just don't want to forget in this is the need to get support, know how to get help fast. Again, I brought up the EAP. There are tons of hotlines, suicide hotline. I know IBH has the 800 number available 24/7 for crises. So there's a lot of it's important to know where to get support when you need it. And make an appointment with your doctor. The doctor is one of the first lines of defense against depression. I'm a therapist. If I know somebody might be depressed, I would always recommend seeing a doctor. You can see your primary doctor. You don't necessarily have to go find a psychiatrist or something. Physicians are familiar with mental health issues. They're familiar with, to an extent, the medications that are used. A lot of primary physicians will prescribe certain antidepressants or anti-anxiety meds, or if not, they would know who to refer you to. But it's something that you should definitely see your primary physician or your family care provider, doctor, and they could diagnose and treat in terms of medications if they're needed, and also refer you out for other treatment. And again, treatment can include medication, talk therapy, referrals for other medical or behavioral health therapies. There's a lot of different therapies that are used or can be used. There's just so many. And I guess one more time to say, the EAP is a good place to get started. The EAP offers a lot of assistance for all kinds of issues, grief, relationships, workshops. I mean, pretty much anything you want. I sort of have a thing. If you're not sure if you can get it through the EAP, feel free to call and find out, because if they don't offer it, they can point you in the right direction. And I really do appreciate everybody for your participation in coming today. And I think we're at the end here. I don't know if anybody has any questions. Thought there was one more slide, but it's not moving. There it is. Whoop. And I don't know, were there any questions or anything? I hope that you got something out of this. And if you do have any questions, feel free to give us a call. Give your EAP a call.
Oh, thank you, Daryl. We do have a couple of questions here from members. So I'm just going to read the first one out loud. How can we advocate for friends who are depressed but don't want to get help?
Okay, that's an excellent question. Advocating for friends who don't want to get help. We can't make people get help. Well, I will say, let me change that a little bit. Usually we can't make people get help. If somebody's depressed, the best thing that you could do is sort of offer them the support, let them know that help's available, and continue to make that available to them. If being But you could also help by finding some of the things I talked about, noticing for yourself, like what are triggers, what things help me to feel better, and that kind of thing. With a personal friend, one of the things I would think of was I would sort of try to see if I could identify some of those things for my friend. So if I notice that it seems to help them uh, to be around pets, to get some exercise, to go horseback riding. But you could always different things tend to be helpful. So you could do the roundabout way. Now, if you have any indication that somebody that is a friend, family, anybody might be at a point where they're going to harm themselves, I wouldn't really give them much choice, to be honest with you. I mean, if somebody told me that they were going to kill themselves, and they weren't willing to get help, I would, to be honest with you, call the police, tell them. I mean, if it gets to that point, now we're talking about suicidal. But as far as the depression goes, really, you just keep encouraging them and try to maybe show witnesses that it can be helped. Share your own experiences. I don't know if that's answering your question, but.
Okay, thank you, Daryl. So I have one more question here. Do you know of a resource that provides screening tools that are more geared toward chronic, lifelong depression patients?
Yeah, I honestly, I would go to the link that was on one of our pages here. Do they have access to these slides, Brenda?
Oh yeah, I'll send the PowerPoint out in a follow-up email along with the link to the archived webinar.
Okay.
Yeah,
Because
so they'll have that.
there's the one page where it did the screening tools, and it gave a just looking if I can get back to it. Where'd it go? At the bottom of this page, the SAMHSA website.gov, they have a lot of good things about mental health. They have a lot of the screening tools and things like that on that page. This is a very specific, but if you see the samhsa.gov, they really do have a lot of good resources there. The only thing that I would say is if it really doing a serious diagnosis, there's not really any one tool that's perfect for that. You really have, that's why it's important to see somebody, because you can't answer questions and diagnose somebody based on check boxes or saying yes, no answers. You really have to have a conversation with somebody to make an accurate diagnosis. I don't know if I'm answering your question, but.
Okay, thank you. I'm just going to move on to the next question. Can depression be genetic? And if so, are there lifestyle factors that can help prevent it?
Yeah, that's a great question. Definitely there's evidence of what's the whole nature versus nurture argument, and definitely there's strong evidence that there's some genetic factors that contribute to somebody having a propensity to have depression. So there is a genetic link that's been found with some depression. It's like a lot of things with mental health. It's not anywhere near 100%. This is the best example I can give. I saw and this is a different. It's not depression, but it still goes with the same thing. I was at a conference one where regarding alcoholism, and the speaker compared alcoholism to heart disease. He mentioned that somebody could be genetically predisposed to get heart disease, and no matter how they live, they will get heart disease. And somebody could be genetically predisposed to not get heart disease. No matter how they live, they're not going to get it. But he said that's very rare, that most people fall in a continuum between the one side and the other. And he said alcoholism is the same way, that we could typically, our predisposition genetically is making it more likely to be an alcoholic or be addicted or to be depressed, or less likely to be have that thing, including depression. And that our lifestyles can have an influence on, and we should assume that it does, because that's what we really have control over. So I guess depression, I absolutely believe genetics are involved, but I also absolutely believe that our lifestyle is important in terms of how we deal with that. The lifestyle, in what ways? I mean, absolutely things like it's a holistic approach, exercise, treating yourself socially, being around people that are positive, doing things that are healthy and good for us physically, and uh, I don't. I guess again, knowing what's good, what types of things are healthy, and what type of things help us to feel better about ourselves. Absolutely, all of those things are important. I don't know. 30-second answer. Tried my best.
Okay, thank you, Daryl. We do have a couple more questions. So, what is the percentage of overcoming depression through exercise?
That's a tough one. I honestly don't know the percentage of that. I don't know. I think that it's definitely been extensively studied. The thing with percentages and studies of those kind of things, I don't think there's been different results. So it depends on what study you look at. I do know that one of the most respected studies I saw that was done double blind and all of that showed that, and I don't know the exact percentage, but it showed that people that suffered from major depression, a higher percentage who exercised, and I don't remember the specifics of it, like ran so many miles a day in conjunction with their treatment, had a much higher success rate than people who just got the treatment. But I couldn't, I don't know that I could cite any specific percentage on that. I think that would be a hard thing to find. But definitely a lot of studies have shown that exercise definitely has a positive effect on overcoming depression and preventing it.
Okay, thank you. I think we have time for one more question. Many people don't seek treatment for depression. Do you have any suggestions on how to encourage someone to seek treatment?
Yeah, I think that as a like from a personal point of view, there's different ways to do it versus personally and professionally. I think from a personal point of view, I think to encourage people to seek treatment, I think it's always easier. I think the biggest, well, I guess I don't, it's not really just my opinion. The biggest obstacle for people seeking assistance for any mental health issues is stigma. So the best thing that we can do to help encourage people to seek treatment is to help in getting rid of that stigma. Now, I don't mean socially, definitely that's something we should do, but on a personal level, helping people to understand that it's, we all need help sometimes. A lot of times that really, for me, if I was with a friend, it would involve self-disclosing things for myself, when I've needed help in the past and how I've gotten help, or other people, and showing them, giving them examples that it's okay to get help. I think that it's showing people that help, that getting treatment can be effective, and trying to show examples of that and give people examples of that. Being willing to go with somebody, to call with somebody. If you feel uncomfortable, I'll go with you. I mean, it depends on how close you are and what your relationship is, but um, and I know there's no surefire way to make somebody do something they don't want to do. And to be honest with you, if you push somebody into treatment, and they don't want to go, as a therapist, it's going to be ineffective anyways. I mean, it really is important to try to get people to want to be there. But it's definitely a challenge, and I get the challenge, and I understand this question. I think come up a couple times. It's a common question, but just keep encouraging and keep recommending. Anything else? I don't know.
Yes.
Was that
Yeah.
it, Brenda?
We have one more question. I don't know if
Sure.
we have time. We can make it quick.
Yeah.
Do you have any insight? Do you have any insight on how to recognize signs of depression in kids and teenagers?
Oh yeah, that's definitely a whole topic. We actually have a whole training on suicide prevention with teens. Um, Really, a lot of the symptoms are very similar. Um, Definitely the irritability, the changes. The thing that becomes, I think, trickier with teenagers and kids is because a lot of those things happen during pre-adolescence and adolescence. You'll see a lot of those things even if there's not depression. So I think with teenagers, children, I think it's more important to try to be a little bit more uh, sensitive to what's going on with them. Um, the question was about identifying symptoms, right? I believe a lot of the symptoms are really the same. Definitely, mood changes. I think isolation is a huge thing with kids. I mentioned uh, how important supports are. But I think all the symptoms are very similar, but the social symptoms I think are more critical. So I guess that's how I would put it, because especially in teenage years, because um, the social paradigm that they're living in is and when a teenager, that social aspect of life becomes so huge. I mean, it's like the biggest thing. The peer support, peer pressure, all of that kind of stuff. So I would say that looking for signs not just of the person, but maybe of the social environment they're in. If the person is being sort of like looking for bullying and things like that, because those will definitely be major triggers for depression, and seeing how they get, that the whether the person has the supports in their peer group, I think is a huge thing, and watching for those. But otherwise, really, a lot of the symptoms are the same in terms of changes in eating habits, changing in sleep, looking for the changes and things. But I think the social part becomes more emphasized, and I would pay attention to that a little bit more. Anything else?
Yeah, we do actually have a few more questions, but it looks like we've already gone over the hour.
Okay.
So we can follow up with anyone whose question was not answered with an email later on this afternoon.
Okay. So you have the questions and we email them out, or how does that work?
I have the questions, and we'll have someone from clinical staff follow up.
Oh,
Yeah,
okay. Okay.
via email. Yeah.
Excellent. All right. Well, thank you. Thank you, everybody. Thank you, Brenda.
Thank you, Daryl. Thanks for presenting. Yeah, and as a reminder, we will be sending out a copy of the PowerPoint from today and the link to the recorded webinar from our YouTube channel. So thanks so much. Have a good afternoon, everyone.
Bye.